Vascular aging in depression and anxiety disorders. Hello. Towards the end of the Congress, I would like to make a different presentation to you. Biological data is also included in the outline of my presentation. Sometimes cardiac problems may be missed, and in the anxiety disorders and depression, we can miss the diagnosis of vascular and cardiac related problems. It is important, we need to deal with that, and I will try to give my perspective. Depression is a common mental disorder. Globally, more than 300 million people of all ages suffer from depression. Depression is the leading cause of disability worldwide and is a major contributor to the overall global burden of disease. It is from World Health Organization 2015 data. We can see that it is a big problem, and it increases the disability. At its worst, depression can lead to suicide. Close to 800,000 people die due to suicide every year. Suicide is the second leading cause of death in 15 to 29 years old. Currently, on our daily basis, 50% of our cases in total effective treatments for depression is that amount. It is very less. Psychiatry is a bright, shining star, but still we cannot provide effective treatment for depression. Here you can understand the burden of depression is on the rise globally. There are interrelationships between depression and physical health. For example, cardiovascular disease can lead to depression and vice versa. This is not coincidence. It is important. It is like if you have an arthritis, it can cause two physical obstacles, but when it comes to cardiovascular diseases, it can cause some fatal problems. That's why it is a big problem. Anxiety disorders are increasing worldwide. It is the same like depression. More case comes with anxiety. Between 1990 and 2013, the number of people suffering from depression or anxiety increased by 50%. There is scientific evidence from the field of behavioral medicine that has demonstrated a fundamental connection between mental and physical health. For instance, that depression predicts the occurrence of heart diseases. Cytokines, physical pathways provide interaction. Endocrine system, for example, hypothalamus and pituitary axis is very important because it includes the depression component of physical disorders, and on the physical disorders, depression is taking its roots from that pathway. Psychological systems such as neuroendocrine and immune functioning are such pathways. Health behavior is another pathway and concerns activities such as diet, exercise, sexual practice, smoking, and adhering to medical therapies. These can trigger cardiovascular diseases. Inclination to smoke. When you have cardiovascular disease and depression, compliance to their own treatment is affected by some psychological factors as well. Yes. Expected life expectancy is 10 years lower compared to the general population. This is very important. People with major depressive disorder are at increased risk of premature mortality. Recent research suggests that cardiovascular and metabolic diseases are major factors contributing to premature deaths. Panic attack may not kill you, but it can decrease your life expectancy. Physical activity decreases mortality. Big body mass index is associated with depression. In one of the meta-analyses, major depressive disorder patients, 75 of them do not recommend the PA guidelines. They live rather sedentary and passive lives. For the anxiety and cardiovascular disease, there is a similar relation. Hypothalamus and pituitary axis is a stressor. It induces stress, and there are many relations with cytokines and other pathways. As I have already stated, it is related to cardiovascular coronary diseases. Anxiety is related to the incidence of cardiovascular and coronary heart diseases. Anxiety was associated with a 26% increased risk of incident heart disease and 48% increased risk of cardiac mortality. Yes, they're on a pathway. If it becomes repetitive or chronic, that anxiety processes, if they have become chronic, then mortality risk of these patients increase. Evidence is mixed on possible gender differences in CVD risk, though anxiety and depression are generally seen in female. Cardiac risk factors are affected by anxiety even in females compared to men in more different ways. Mechanisms of cardiopathogenesis are lesser known than depression, but are most consistently demonstrated in panic disorder and GAD. General anxiety disorders. Likely risk factors include hypertension or some other metabolic disorders. With regard to the latter, diminished heart rate, variability reflecting impaired vagal function and inflammatory dysregulation is also observed. What is arterial stiffness? Arterial stiffness is one of the major signs of vascular aging, which has been documented as a prominent independent prognostic factor of cardiovascular mortality. Progressive loss of arterial elasticity may cause important complications such as stroke, left ventricle hypertrophy, and hypertension. Therefore, arterial stiffness has increasingly drawn attention for its role in the cardiovascular diseases. Vascular stiffness, vascular aging, is one of the independent mortality factors. Arterial stiffness is equal to arterial flexibility loss, hypertension or hypersensitivity comes after that, so it is a precursor for more severe diseases. Vascular stiffness, arterial stiffness is becoming more and more important for cardiovascular diseases. Increased arterial stiffness was linked with systemic inflammation in patients with psoriasis. In a study, anxiety was associated with cardiovascular diseases, and it was hypothesized that inflammation has a role in that association. Thus, inflammation may have a critical role between arterial stiffness and anxiety. In conclusion, arterial stiffness is thought to show endothelial dysfunction and coronary heart disease. When inflammation enters into the body, there are many median factors for this disease. Diet, endocrine values have dual interaction. Depression, systemic inflammation, they have dual interaction between each other. This is important. Arterial stiffness is very, very crucial. System shows some endothelial dysfunction, and it is a very basic problem of cardiovascular branch. endothelial dysfunction, coronary heart disease, arterial stiffness, and then 10-year lower life expectancy comes at the end. Maybe we can think about certain things. Assessment of arterial stiffness parameters. All participants were refrained from eating and drinking alcohol, coffee or tea for at least 12 hours prior to the study. The stimulants were not given. On a supine position, especially in the morning, with that standard position, measurements were taken with certain parameters, pulse and augmentation index, velocity. They were used. They may seem a bit technical terms for us, but ejection wave and cardiac pumping and then reflection wave are taken. The system measures everything. It is like hypertension or hypotension, blood pressure. So this is the device which measures these functioning values. We have measured it in our own case, and you can see the result on augmentation index and pulse and velocity. This is a bit more specific. It is the first ejection wave, and this is the reflection wave. You can see the system gives you directly the results in a documented way. Results in patient with panic disorder. While baseline characteristics were similar between two groups, BDI and BI scores were significantly higher in patients with PD. There was a moderate correlation between PWV and other disorders. And on this chart you can see some figures compared to healthy controls. Mean average is higher, and it is correlated to the violence. Parameters are in negative correlation with the panic attack disorder. And our hypothesis has somehow been confirmed. And baseline characteristics and clinical data were similar between the two groups. BDI and BI scores were statistically significant higher in patients with depression and anxiety. There were significantly parallel values available, but compared to healthy controls, the depression patients seem worse. It was published in Psychopharmacology Bulletin magazine. There are some results of the pulse wave velocity. Is available on the screen. Mean average is higher than the controlled healthy group. With respect to correlation, median and mild correlations are observed based on the severity of the symptom. So in conclusion, we have shown significantly increased arterial stiffness parameters in panic disorder and depressive patients. We revealed positive correlation between anxiety and depression scores and arterial stiffness parameters in patients with panic disorder and depressive disorder patients. The frequency of panic attacks may be important for arterial stiffness. We could not clarify the relationship between arterial stiffness parameters and antidepressant usage. We have to be more vigilant in terms of evaluation of these points with our patients. We have to be making more careful evaluations by looking at their complaints. I'm interested in a different area of my own branch. That's why I check myself when I do new routine examinations with my patients. Arterial stiffness, endothelial functions in the upcoming stages, we know they are going to be very important in our diagnostic methods. Unfortunately, there was a limitation in our treatment. We don't know that whether the antidepressant treatment is protective or not, because severity of the symptom and the illness scores are in correlation. We can see there is a correlation, but we don't know which agents are effective, which agents are not effective from the antidepressant side. As I mentioned, it is related with panic disorder. When the symptoms become more chronic, the prognosis is going into a worse direction, a worse status. Thank you very much. I just wanted to take your attention to this very important point. Thank you very much for your patience.